Well, we have a cohort of patients from the capital region of Denmark, which is a cohort based on catchment area. So it's not a population-based study, but approaching. And it's a pretty large cohort, approaching almost 400 patients. So what we basically found in comparing men and women were that there were differences in the two populations. The women were in general older, but they actually were they were actually not more morbid. Their multimorbidity was slightly lower than in the men. But what we found, which is probably more a general finding, I think, than just applying to OAC-ICH, is that the treatment positivity seems to be lower in women than in men, meaning that women, in spite of having the same clinical problems, the same volume of bleeding, had a lower chance of receiving interventions and a higher risk of having early do not resuscitate orders. But otherwise, these were the main differences we found, and I think this is something we have to look into at a more general basis. That in spite, I don't think there's anybody out there thinking women are worth less than men. We don't want to treat women or something like that. But I think that we, both as doctors and healthcare professionals, both independent on whether we are men or women, have a tendency to an implicit bias, seeing women as more frail, more weak, with a more poor prognosis than the men. And we have to think about this so that we can actually start treating the patients based on their individual characteristics and not on their sex.